Hello and welcome. Today we embark on a comprehensive journey into the world of obstructive sleep apnea, a condition that affects the sleep and overall health of millions worldwide. Whether you're a patient, caregiver, or just someone interested in health, today's in-depth discussion will offer valuable insights. Don't forget to subscribe and hit that bell to stay informed. Part 1. The Basics of Sleep Apnea. We begin with the fundamentals. What is obstructive sleep apnea? How does it affect the body during those crucial rest hours? Understanding the airway. In this segment, we'll explore the airway's anatomy and how its structure and function are intimately tied to obstructive sleep apnea. Knowing more about this can help us understand why the airway behaves the way it does during sleep. Let's start with the basics. The airway begins at the nose and mouth, where air enters the body. From there, it passes through the throat, or pharynx, and continues down into the lungs. The throat comprises several key structures: the soft palate, the uvula, the tonsils, and the tongue. During wakefulness, muscles in these areas are active and keep the airway open. However, when we sleep, muscle tone throughout the body decreases. This relaxation is natural and occurs in all of us. But for those with OSA, the consequences can lead to significant health concerns. The cycle of apnea. Each apnea event can last from a few seconds to over a minute. These events can occur hundreds of times a night, significantly disrupting sleep architecture. Part 2. Risk factors and symptoms. Now that we understand what OSA is, let's explore who is at risk and the symptoms that may indicate its presence. Who is at risk? OSA can affect anyone, but certain factors significantly increase the risk. These include anatomical characteristics, lifestyle choices, and underlying health conditions. Recognizing the signs: snoring, sudden awakenings, a sensation of gasping or choking at night, these are just a few signs of OSA. Part 3. Diagnosing OSA. Diagnosing obstructive sleep apnea is a critical step in managing the condition effectively. Accurate diagnosis not only confirms the presence of OSA, but also determines its severity, which is essential for choosing the right treatment plan. The role of sleep studies. Sleep studies, or polysomnography, are the gold standard for diagnosing OSA. These studies provide a comprehensive look at what happens to your body during sleep. Dr. Emily Ford, a sleep medicine specialist, explains the components of a sleep study and what they measure. In a sleep study, we monitor several physiological parameters: brain waves to determine sleep stages, eye movements, muscle activity, heart rate, breathing patterns, and oxygen levels in the blood. All these factors help us see not just if breathing stops, but how these stops affect the rest of the body. These studies can be conducted in a sleep lab under the supervision of healthcare professionals or at home with portable monitoring devices. Each has its advantages. Home versus lab testing. Some patients opt for home sleep tests. Home sleep tests are becoming increasingly popular due to their convenience and lower cost. However, they are typically less comprehensive than the tests conducted in a lab. Sarah, a patient who underwent a home sleep test, shares her experience. "I chose a home sleep test because it was less intrusive and I could sleep in my own bed. The setup was simple, and although it didn't monitor as much as the lab test would have, it was enough to diagnose my mild sleep apnea." Dr. Alan Marks, a pulmonologist, discusses when a home sleep test is sufficient and when a lab test might be necessary. Home tests are great for many patients, especially those with high pre-test probability of straightforward obstructive sleep apnea. However, for cases where we suspect other sleep disorders or when the results from a home test are inconclusive, we recommend a more detailed in-lab study. Part 4. Living with OSA and treatment options. Being diagnosed with OSA isn't the end, it's the beginning of managing and improving your health. Managing OSA effectively involves a combination of medical treatments and lifestyle modifications. Let's explore the variety of options available to those diagnosed with this condition. Medical treatment options. Treatment for OSA can be broadly categorized into 3 types: mechanical devices, surgical interventions, and positional therapies. From CPAP machines to dental devices and surgeries, treatment options vary. Continuous positive airway pressure, CPAP machines. The most commonly prescribed treatment for OSA is the CPAP machine. It delivers air through a mask, keeping the airway open during sleep. Dental appliances. Dental devices, such as mandibular advancement devices, MADs, and tongue-retaining devices, are effective for mild to moderate OSA. These devices adjust the position of the jaw or tongue to keep the airway open. Surgical options. For those who don't respond to CPAP or dental devices, surgical options are available. These range from uvulopalatopharyngoplasty, UPPP, which removes soft tissue from the back of the throat, to more advanced procedures like maxillomandibular advancement. Positional therapy. Some people experience OSA primarily when sleeping on their backs. Positional therapy involves wearing a special device that prevents this, often simply by encouraging side sleeping. Emerging treatments. New technologies and treatments are continuously being developed, such as hypoglossal nerve stimulators, which electrically stimulate muscles to keep the airway open. Lifestyle changes. Alongside medical treatments, lifestyle changes can significantly impact the severity of OSA symptoms. These changes are often within the patient's control and can enhance the effectiveness of other treatments. Weight management. Excess weight is a significant risk factor for OSA. Losing weight can reduce the severity of symptoms for many patients. Exercise. Regular physical activity can improve muscle tone in the airways and decrease OSA severity. It's not just about weight loss. Increasing fitness has direct benefits on sleep quality. Alcohol and smoking cessation. Alcohol relaxes the throat muscles excessively, exacerbating OSA. Smoking inflames and obstructs airways. Cutting out these habits can markedly improve symptoms. Sleep hygiene. Maintaining regular sleep schedules, optimizing bedroom environments, and establishing pre-sleep routines can all enhance sleep quality and treatment efficacy for OSA. Avoiding sedatives. Sedatives and certain medications can worsen OSA by relaxing the central nervous system too much. Patients should discuss medication adjustments with their healthcare providers. Part 5. Broader impacts and research on OSA. In this segment, we explore the broader impacts of obstructive sleep apnea on health and examine some of the latest research trends that are shaping our understanding and treatment of this complex condition. Cardiovascular and metabolic effects. OSA doesn't just disrupt sleep, it has significant implications for cardiovascular health. Repeated drops in oxygen levels and the resultant stress response can lead to hypertension, coronary artery disease, and heart failure. The intermittent hypoxia experienced by those with OSA, where oxygen levels dip repeatedly, increases the body's sympathetic nervous system activity and raises blood pressure. Over time, these fluctuations can cause chronic hypertension, a major risk factor for heart disease. Moreover, OSA is linked to metabolic issues, particularly type 2 diabetes. The disrupted sleep and variable oxygen levels affect glucose metabolism and insulin sensitivity, increasing the risk of diabetes. Effects on mental health and daily functioning. Beyond the physical, OSA can have profound effects on mental health. The chronic sleep deprivation associated with OSA can lead to depression, anxiety, and significant impairments in cognitive functions like memory and concentration. Day-to-day impacts are also substantial. Sleep apnea can cause excessive daytime sleepiness, reducing a person's ability to function at work or at home, and increasing the risk of accidents. Latest research trends. Turning to research, scientists are making exciting advances in both the diagnosis and treatment of OSA. One area of focus is the development of personalized medicine approaches that tailor treatments based on individual genetic profiles and specific disease characteristics. Researchers are also investigating the potential of alternative therapies, such as positional therapy for those who primarily suffer from OSA when lying on their backs. Innovations in materials science are leading to more comfortable and effective CPAP mask designs, improving patient compliance. Moreover, there is ongoing exploration into the role of inflammatory markers in OSA patients, which could lead to treatments that target inflammation rather than just the mechanical aspects of airway obstruction. We've covered a lot today, from what OSA is to how it can be managed and treated. Remember, recognizing the signs and seeking help early can lead to a healthier, more restful life. Thank you for joining us on this deep dive into obstructive sleep apnea. If you found this series informative, please like, share, and subscribe for more insightful health content. Sleep well and stay healthy.